Hello, good morning. Good morning. Hello,
Good morning, sir.
can you hear
Morning,
me?
sir.
All right. All right. So, I have actually uploaded the slides on nutrition in the life stages, no? At Google Classroom. So that's topic. Okay. There's no. I think we need to begin ready. The Father and the Holy Spirit. Amen. Thank you, Lord. We ask you to bless our sessions and thank you for the good rest that we've had during the weekends and ask for operations to become better persons, more knowledgeable, and be able to use whatever we've learned to your honor and glory. We pray all these in the name of your Son, in the name of and the Holy Spirit. Send- Okay, so we're still waiting for the others, no? All right. So, I actually have uploaded the slides for. I have actually uploaded the slides for nutrition in the life stages, which is our next topic, no, for nutrition fundamentals. Okay. So, uh,
Putol-putol si sir, no? Or basin sa kuha lang? Oo, binakod ako internet. Thank you.
Okay. All right. Sorry. Can you? I think okay na. Okay. All right. Mm-hmm. Perfect. All right. Okay. So our first the nutrition in the life stages or nutrition in the life cycle actually starts with nutrition or diet during pregnancy and lactation. Okay? And it ends up to nutrition in the elderly or old age, no? Okay. So we will cover today at least uh two to two, two to three topics if we can, no? Para mabilis tayo, no? For this week, no? And then uh next week is going to be nutrition assessment. All right? So, can you hear me? Can you see the screen?
Yes, sir.
All right. Okay. So, diet during pregnancy and lactation. All right. So, objectives for this topic is are identify nutritional needs during pregnancy and lactation, describe the nutritional needs of pregnant adolescents, and modify the normal diet to meet the needs of pregnant and lactating women. All right. So those are the objectives, no? Okay. So as you can see, this is as you can see, this is a figure, no, of a pregnant woman, no, yung mga physiological changes. All right. So, why is nutrition important? Why is proper nutrition important during pregnancy? Okay. So first, uh, okay. By the way, um, pregnancy is pregnancy is divided into three terms. Okay. So, di ba, 9 months yan siya. So, the first trimester is usually the first 3 months. Okay. Second 3 months is the second trimester. We call that the second trimester. Um, that's from fourth month, fourth, fifth, at up to sixth month. All right. Then the last trimester is the third trimester is from seventh from seven covers 7, 8, 9 months. Okay, can you see it in this on the screen?
Yes, sir.
All right. So now, why is nutrition important, no, during this period, no, during pregnancy? Okay. So remember, there during pregnancy, pregnant women, pag full term na ang infant, no, full term meaning during the third trimester. Okay. So if you notice, this is the weight gain, no? So there is an average of 30 pounds weight gain of the fetus inside the womb, no, of the pregnant woman. Okay, so there's an increased breast size. Okay, so approximately or to an average of 2 pounds, no. So imagine that is in preparation for lactation already. So that requires nutrients. Okay? So, kung 2 pounds yan, Uh, yung right is an 1 pound, ang left could be an average of 1 pound also, no? So to prepare for breastfeeding later on. Okay, so and that again requires nutrients, no, for the mother and yeah, to support the baby. Okay, and it produces milk, no, breast milk for the newborn or the neonate. Okay, so next is there's also increase in mother's fluid volume, which is 4 pounds. The placenta is 1.5 pound, and there's also an increase in blood supply to the placenta, which is 4 pounds, and there's also an amniotic fluid, which is 2 pounds, approximately 2 pounds, and infant at birth is approximately weighs 7.5 pounds, and there's also an increase in size of uterus and supporting muscles. That's approximately 2 pounds, and the mother fat stores to support during pregnancy and lactation is 7 pounds. All right, so to an average, a pregnant woman at full term, meaning kung full term class, that is the third trimester already. Ang sabi ko nga, first trimester is the first 3 months during pregnancy. Second trimester is from 4, 5, 6 months. And then the third trimester is 6, 7, 8, 9 months during pregnancy. And that requires proper nutrition. Okay, so at full term, the pregnant woman, no, at full term, meaning pag third trimester, the mother is expected to gain 30 pounds. Okay? All right. Uh, as you can see now, this is the placenta, okay, and the supporting structures, no? So, though um, all those require nutrients again, no, or proper nutrition. Okay, so because we are also feeding not only the mother but also the growing fetus inside. Okay, so it is the placenta. The placenta is the organ in which maternal blood vessels lie side by side with fetal blood vessels entering the umbilical cord. Okay, so um, it is the mother's veins which carry fetal wastes, and uh, the and the delivery of nutrients and oxygen to the fetus and the removal of fetal waste products occur between the pool of mother's blood and the placental villi. Okay, so the nutrients are delivered through the um, arteries and veins, no, and the fetal waste, the arteries, okay, the mother's arteries bring fresh blood to the fetus. Okay, so the blood which contains the nutrients will feed the growing fetus. And then, of course, if you are feeding something, no, or somebody, then there should be wastes, no, in the process. So the wastes are carried out by are carried by the veins. All right? So ganyan ang kuano. So especially among ladies, no. So ganyan ang mangyayari. Okay? So this requires ang my only point here is that it is complex, no, but yet my point here is that it requires nutrition. Okay, proper nutrition is required during pregnancy. Okay, So, all right. Another is uh, the stages of embryonic and fetal development. So, apart from the mother, apart from the mother, um, na at full term, at full term will require increase in body weight, no, to an average, no, kung normal ang pre-pregnant weight niya, it's around 30 pounds. And then you have seen earlier, no, as I presented, that there is a placenta and the supporting structures. All right. So now we are also supporting the baby, no, or the growing fetus. Okay. So we have the stages of embryonic and fetal development. This is a newly fertilized ovum. This is about the size of the period at the end of the sentence. This zygote, all right. So what you see is a zygote at less than 1 week after fertilization is not much bigger and is ready for implantation. Okay. So second, after the implantation, the placenta develops and provides, so meron ng fetus inside, no? So, begins to provide nourishment to the developing embryo. Okay? Embryo or embryo, no? So, the embryo, 5 weeks after fertilization, is about 1/2 inch long. Okay, so again, that requires additional nutrients for the mother because she is supporting the fetus, the growing fetus inside. Okay, and then eventually that growing fetus becomes grows, no, or I mean grows. So this is the third stage of the third stage. This is growth, no. A fetus after 11 weeks of development is just over an inch long. Notice the umbilical cord and the blood vessels connecting the fetus with the placenta. Okay, so that's how it looks like, no. All right. So, uh, and the last stage, pag full term na, the fetus after 11 weeks of the development is just over an inch long. Notice the umbilical cord and the blood vessels connecting the fetus with the placenta. Okay, so, di ba, imagine for pregnant women, there is a growing baby, no, or a growing fetus inside of you. So, which requires nutrition in the process. Okay. Now, let me ask you, no? Uh, let me ask you, uh, which do you think is the, which do you think, okay, can you hear me?
Yes,
All
sir.
right. Which do you think is more critical during pregnancy? Is it the early stage of pregnancy or the later stage of pregnancy? Early, very good. Okay, so that's correct, no? The early stage of pregnancy is more critical, okay? Critical periods occur early in development. An adverse influence felt early can have a much more severe and prolonged impact than one felt later on. So if an adverse influence felt later temporarily, um, uh, felt late temporarily impairs development, but a full recovery is possible. Okay? So, that is how, no? Ito kasi, this is the time here, no? Sa x-axis is the time, and then the critical period is during the early stage of pregnancy. Okay? So, ng x-axis, no? So, if there is an adverse influence felt early, permanently impairs development, and a full recovery never occurs. Okay, so uh, say for example, if the mother does not know that she is pregnant and she is taking alcohol or some other substances during the early stage of pregnancy, or she might be taking drugs, no, or drugs, it could be for treatment, no, which affects the baby, no. So there's a chance na um, that can affect the baby, and that's something that is irreversible. Okay, the effect to the growing fetus is irreversible. Okay, so hindi na siya maka-fully recover, no. So yung purple dyan, that is the normal development. Okay, that's the normal development, no? But if it happens during the early stage of pregnancy, mahirap na makarecover. Okay? But if it happens after the critical period, no? If an adverse influence is felt after the critical period, there is still a chance to recover. Okay? So, uh, that is the reason why, class, that most of those na um makukunan, no, or magkakaroon ng unsuccessful pregnancy, or um unsuccessful pregnancy, makunan, no? That usually happens during the early stage of pregnancy, because that is the critical period. Okay? So, and therefore, because of that, again, nutrition plays a vital role, no? In order for the fetus to develop and to also keep the nutrition of the mother. All right, so is our concern here is talaga the fetus and also the mother at the same time. Okay, so um this is a critical periods uh critical periods in human development. Okay, so kindly check, no. So yan, no. uh Central nervous system is from weeks. Central nervous system is happens from the third week up to the 16th week of the fetal period, no. So yan. All right. So, uh, therefore, my point here is that ano lang, proper nutrition is really important, no? Okay. Now, weight gain during pregnancy. An average weight gain is 25 to 35 pounds for normal weight women. Okay, so as I presented earlier, 30 pounds yan siya to an average. Okay, 25 to 35 or 30 pounds, no? To an average for normal weight women. So depende yan whether pre-pregnant weight is obese ba o overweight or obese ba ang mother, or the pre-pregnant weight is underweight ba, or depende din yan, no, kung the mother is carrying twins. All right, so underweight women should gain more. All right. So underweight women should gain 28 to 40 pounds. So instead of just 25 to 35 pounds, for normal weight women, underweight women should gain 28 to 40 pounds. Okay. So dapat um, higher than the normal weight women. Okay. So for during the first trimester, there's 2 to 4 pounds weight gain, and then the second and third trimester, mabilis na yan, no? Ah, hindi pa masyado manotice during the first trimester, well, except for, sometimes you would notice na there are changes, no? Like naga nagasuka ang mama, no? But there are still no changes, no? You cannot identify whether the um the woman is pregnant or not, no? Kasi hindi pa siya noticeable, no? For the first 3 months of pregnancy. But during the second and third trimester, um, kasi mabilis na ang increase in weight, no? Imagine 1 pound per week. The pregnant woman will be gaining 1 pound per week. So mabilis yan siya. So you would notice na hala na nambuk lagi ka because the mother is gaining 1 pound per week, and that is noticeable. Okay, so remember that no one should lose weight during pregnancy. Okay, again, no one should lose weight during pregnancy. All right, so do not worry, no, especially ladies, no. Well, of course, gentlemen, you have to know this, no, so that you can support future partners, no. Okay, weight gain during pregnancy. No additional calories are usually required during the first trimester. Now, an additional of 300 calories needed during the second and third trimesters. Okay? So, second and third trimesters, meaning from fourth to ninth trimester, every day, you need to add 300 calories to the normal requirement. Okay? So, if you remember, 'di ba, we have computed the total energy requirement. You know how to compute the total energy requirement, right? So, say for example, you have identified based on the height and the physical activity, no? The height and the physical activity that the requirement of the mother is 1,600 calories. So you need to add during the second and third trimester 300 calories more. So from 1,600, you need to add 300 during the second to third trimester. That is every day. So instead na 1,600, no, na pre-pregnant weight plus 300, so that becomes 17, 18, 19. So magiging 19 na yung needs niya, yung dapat caloric intake, no, so to support proper nutrition for the growing fetus and other nutritional needs of the pregnant woman. Okay? Now, folic acid supplementation, this is folic acid supplementation prior to conception decreases the risk of brain and spinal cord defects. Okay, yung folate class, no? So if you take a look at milk that is designed especially for pregnant women, that is actually added or enriched, no, could be enriched or fortified with folate or folic acid to again decrease the risk of brain and spinal cord defects. All right, so as you can see here, this is the recommended total weight gain. The recommended total weight gain ranges for pregnant women based on BMI status. Okay. So if the BMI is low, meaning 19.8, that's pre-pregnant, uh, low, ang weight gain ranges niya is 12.5 to 18 kilos. Pag normal is 11.5 to 16 kilos. Okay? And as the weight for height increases or BMI increases, the weight gain decreases. Pero but you can see mag-increase pa rin ang weight gain because there should be no mother or a pregnant woman who should lose weight during pregnancy. So meron pa rin pero medyo controlled na. Okay? So, yan. This is the recommended total weight gain ranges for pregnant women based on BMI status. Okay? All right. So, this is another table, no? So, you can also base the weight gain expected weight gain depending um on the um stage of pregnancy. Okay? So, yeah. All right. So, how about those who are carrying pregnant women carrying twins? No, the target weight gain at term for women carrying twins is 35 to 45 pounds. Okay, so kung 25 to 35 pounds for normal weight women, tapos hindi twin ang kinikerry niya inside her womb, that is just an average of 25 to 35 pounds at full term or 30 pounds at full term. But kung dalawa women carrying twins, the target weight gain at term, no, at full term, meaning during the third trimester, that is 35 to 45 pounds. All right. So, nutritional needs during pregnancy. The protein requirement is increased by 20% for pregnant women, a woman over the age of 25. Okay, so 25% for the pregnant adolescent. And there is no need to increase vitamin A because, as I have mentioned, uh, I think I've mentioned this during when we discussed the vitamins, that excess vitamin A can cause okay, so craniofacial defects, no, um, because there are pregnant women na during pregnancy, they mm, they 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 develop acne, no, so one of the treatment that is given to them is isotretinoin. Okay, this isotretinoin is a vitamin A analog. So in other words, this since isotretinoin is vitamin A analog, later on that can have a that can cause birth defects to the growing fetus inside growing fetus inside the womb. Okay? So paglabas niyan, matingala ka, there are deformities, no? That is because of vitamin A toxicity pala. Okay, so the vitamin D requirement is 10 micrograms. Vitamin E requirement is 5 micrograms. Vitamin K requirement is 75 to 90 micrograms depending upon the age. Okay. So requirements for all the water soluble vitamins are increased. Okay. So again, what are our water soluble vitamins?
A, D, A, K.
Water soluble vitamins? Vitamins.
Vitamins
B6
B6,
and
sir.
C, sir.
Vitamin B12.
Okay.
Vitamin C, sir.
Okay, very good. No, so the very good vitamin C and the B complex vitamins B1, B2, and so on and so forth. All right. So all those increases, no, all those increase during pregnancy. Okay. The A, D, E, and K, those are the fat soluble vitamins. All right. So requirements for the B and C are increased. Requirements also for calcium, iron, zinc, iodine, and selenium are all increased. And iron supplements are commonly prescribed, no? Kaya um, during pregnancy, uh, it is normal that pregnant woman is taking or will be taking ferrous sulfate, okay? Because her diet cannot supply the need for iron, no? Because of uh, the physiological changes, okay? So iron in the diet is not sufficient, therefore supplementation is needed, okay? All right. So, as you can see here, ang pinaka-critical na mga pinaka-critical na mga um, nutrients na during pregnancy is we have iron, okay, na uh, this one kasi is yung yellow dyan is for non-pregnant. Okay? Yung orange dyan, I don't know if it's orange or red. No, yung is that that signifies or symbolizes pregnant women, and lactating women is yung purple or yung violet dyan. Okay? So, uh, you see, ang energy, no, increases from pre-pregnant as condition, then ang pregnant increases, and then eventually mas mataas pa siya during lactation, yung purple. Okay, orange at saka purple. So an energy allowance during pregnancy is for second and third trimester. So no additional allowance is provided during the first trimester. Okay, so another nutrient that increases, no, that is needed really during pregnancy is iron, no. So if you take a look at the iron needs ng pregnant at saka ng pregnant women, no, same lang ang need for pregnant during pregnancy and lactation, but no, sorry, non-pregnant na condition, no, at saka lactating, pero during pregnancy dapat mataas ang mataas ang needs, no. That is why iron supplementation is needed. Okay, so this figure will tell us what are the nutrients that increases during pregnancy and lactation. Okay, I will not dwell so much about it. No. Okay, so this one. Okay, can you see the screen?
Yes, sir.
Yes,
Okay.
sir.
All right. So this is a spina bifida. Okay. So this is a spina bifida. This is a neural tube defect. Okay. Pero ito class, this is after the surgery already. Okay. After the surgery. The reason why folate or folic acid is important during pregnancy, to be enough folic acid or folate is important during pregnancy because we try to avoid neural tube defects, and one of the neural tube defects is spina bifida. Okay, so ang spina bifida, what happens in spina bifida is imbis na yung bones is mag-close, no, yung very slender na bones dito sa likod banda, dito sa may um, malapit sa buttocks, no, dyan, which protects the um, spinal cord, no, the spinal cord, no, um, the spinal cord uh, fails to connect, no? So magiging siya open because of lack of folate or folic a lack of folate or folic acid. Okay, so spina bifida is a neural tube defect or NTD. The interruption in the spinal cord results in paralysis, and below the injury, this photo shows the back after the surgery to close the interruption. So ito, nag-undergo na ito ng surgery. Okay? Nag-undergo na yan ng surgery. Okay? So, these are some food items of foods that are fortified with folic acid. Okay? So, again, when we discussed about vitamins and minerals, kahit yung mga, merong mga hair lip or cleft palate, that is, sabi nga ng ibang nutritionist, it could be due to lack of folate or folic acid. And one of the rich source of folate or folic acid is yung green leafy vegetables natin. Malunggay is very rich in green leafy vegetables. Okay? So, can you see the screen? So, ito yung nangyayari, class, oh. Ganyan siya. Can you see it? Oo. So, ganyan ang sa yung spina bifida, which is a neural tube defect. Alright? So, this is a spina bifida. Okay? So, normally, this is the normal. Okay? So, itong bones na ito, okay? Itong bones na ito should connect, no? So, to protect the spinal cord, no? Spinal cord and yeah, the spinal cord. And then, pag if there is a spina bifida, okay? So, if there is spina bifida, so you can see yung dalawang bones dyan fails to connect, no? So, exposing the spinal cord, no? So, that can, which can cause paralysis. So, yan ang nangyayari. So, normally, the bony central chamber closes fully to encase the spinal cord and its surrounding membranes and fluid. In spina bifida, the two halves of the slender bones, yung slender bones dyan, that should complete the casement of the cord failed to join. All right? So, therefore, if that fails to join, no? So, in serious form, shown in the right side, no? So, if you can see, in serious form, membranes and fluid have bulged through the gap and the nerves are exposed, invariably leading to some degree of paralysis and often to mental retardation. Okay? So, kaya it can cause mental retardation and eventually, pag hindi makayanan, early death ng individual who has spina bifida. Okay? All right. So, the how do we fulfill the nutritional needs during pregnancy? So, again, base the diet on the My Pyramid and drink additional fat-free milk or proper appropriate substitute. Prenatal vitamins and iron supplement may be prescribed, and also over-the-counter nutrient supplements may be harmful to the fetus. Okay, yung mga over-the-counter nutrient supplements. Well, except of course for iron, which is normally uh, normally prescribed during pregnancy. But the rest is it can be harmful, especially vitamin A, which is toxic, no, during pregnancy. So during our first meeting, I think first or second meeting, I have introduced to you the food guide pyramid. So you can follow the food guide pyramid, and that's actually uploaded in the Google Classroom. So you can follow that one. No, there's a link there for the food guide pyramid. So you can follow that one, so that you can follow that one for uh, to be guided for the uh, for the nutrition of the pregnant woman, no? Ano dapat ang intake ng pregnant woman? Okay, so prenatal vitamins and iron supplement may be prescribed, and again, over-the-counter nutrient supplements may be harmful to the fetus. Okay, so what are the concerns during pregnancy? It could be nausea, constipation, heartburn, excessive weight gain, PIH or pregnancy-induced hypertension, pica, okay? So anemia, alcohol, caffeine, drugs, and tobacco. So these are some common concerns during pregnancy, okay? So which affects nutrition, okay? So nausea or morning sickness. Okay? Yung morning sickness na tinatawag natin in class only happens during pregnancy, ha. Please do not use the word pag kasukaon ka after rising from bed, nakasukaon ka. That's not morning sickness kung hindi ka pregnant, no? That term is only applied during pregnancy, especially during the first stage of the early stage of pregnancy. Okay, morning sickness, no? Suggestions for nausea, kanabang nausea is that feeling na you want to vomit, no? You like to vomit, no? So suggestions, eat dry crackers or dry toast before rising. Eat small, frequent meals. Okay? Konti-konti lang. Avoid food with offensive odors. Avoid liquids at mealtime. Okay? All right. So those are the suggestion for nausea. Okay? um kanaganing for example during the time na pregnant women tapos na ay maggisa og ahos or bombay, nako kuha na siya, maka-ano na sa maka-trigger na og nausea during early stage of pregnancy. Okay, kasi very offensive ang odor niyan, no, for a pregnant woman, no? Because of um you might ask, ano the reason why, bakit merong mga ganyan? Yeah, well, there are hormonal changes during pregnancy. Okay? All right. So, what is hyperemesis gravidarum? Okay? Can you still hear me? Can you still see the slides? The screen, rather.
Yes, sir.
Okay. What is hyperemesis gravidarum? Hyper meaning increased or high, and then emesis is emit, no? Or emit, no? Or pag-vomit, no? Gravidarum, gravida pertains to pregnancy, no? This occurs when the nausea becomes so severe that it is life-threatening, okay? So which requires this may require hospitalization and parenteral nutrition. Okay? So, it can be life-threatening, no? Sigig suka, no? Because, remember, sigig suka, uh, there would be imbalance in the water and electrolytes, no, leading to dehydration. So some women, pag grabe na talaga, that may require hospitalization and parenteral nutrition. Yung parenteral nutrition is yung nutrients will be transported through the veins, no? Okay? So that's parenteral nutrition. Okay? All right. So what about constipation? Okay? So constipation is another problem during pregnancy. This is caused by relaxed GI tract or gastrointestinal tract due to progesterone. Okay? So what are the suggestions? Eat a high fiber diet, participate in daily exercise, okay? And participate in daily exercise, and drink 8 glasses of water per day. All right? Uh, okay. Wait lang ha. I need to reply to your dean. Okay. Can you see this screen again for our? Can you see the screen? Okay. So constipation, participate in daily exercise, and drink 8 glasses of water per day. All right. So that prevents or that is the treatment for constipation. Okay. Uh, Heartburn class is that feeling na kanaganing murag masunog ang imuhang ang imuhang ang stomach no kay grabe ka okay just like this one no grabe ka acidic no um usually I actually have heartburn no this does not only happens during pregnancy but this happens uh to to anyone no so if you have noticed na kanaganing uh if you there are people na if they drink coffee na mag maghapdos ang ilang tiyan no so that causes heartburn okay hapdos kaayo na murag no, masunog no eventually di maabot sa lamunan no or sa esophagus eventually mag-vomit no so that's heartburn that is also experienced by pregnant women okay so this is caused by pressure on the stomach by the growing fetus and relaxation of the cardiac sphincter. So, what should be done during this stage? Okay, so eat small, frequent meals, avoid spicy or greasy foods, and avoid liquids with meals, and wait at least an hour after eating to lie down. Okay, and 2 hours before exercising. So siguro kayo, probably kayo, you have not yet experienced this, no? But ako, grabe talaga. Not because I am pregnant, but because of stress, no? Kasi this is not only among pregnant women, no? Pwede din na hindi ka pregnant woman, you may experience heartburn. Kana bang class na I do not know if you have you tried drinking alcoholic beverage? Anyone? I mean, uh, share lang. Or mga buutan mo. Mga buutan. Okay. That feeling na gusto ka kasukaw tapos hapdos ka imuhang kutukuto, no? Hapdos ka ang kutukuto that's actually heartburn, no? Especially kanang naay mga people with gastric gastric uh, tawag nito people with yung may mga uh, gastric problems no unsa ganina tawag sa ato oy kanang especially pag stressful ang work no uh, stressful ang work no so ako and then also kanang dili magkaon og regular na does not follow a regular schedule no often skip meals no yan that could be a problem, no? That and For pregnant women, really normal na it's very common that they experience heartburn. So these are the ano the suggestions, no. Eat small frequent meals, avoid spicy and greasy foods, avoid liquids with meals. Kaya ako, usually I listen to my body, no. um, Pag ganyan, I try to avoid liquids with meals, no? Pati yung drinking Coke, no? Depende yan, or Coke or soda, for example, or soft drinks, for example, I try to avoid that, no? Um, Kasi especially pag magbutod ako ang tiyan, no? Butod akong tiyan, dako ka ang tiyan, there's a chance na, nako, magsuka na, tapos kailangan mag-rest sa jud ko ana, otherwise kung magsakaw ana, there's a chance na magsuka ko, no. So that is also so wait at least an hour after eating to lie down, and not really to I'll just sit down, or um pero I do not move around, no. I do not lie down, and I do not move around na kanang very physical, highly physical ang mga um uh, that requires movement. 1 hour after eating yan to lie down, okay? And 2 hours before exercising yung liquids. Okay? Kasi ang nangyayari dyan, kasi very acidic kasi yung stomach natin, no? So, that acid will go to the esophagus, no? Okay. All right. Another is excessive weight gain during pregnancy. So, reevaluate diet and eliminate foods that do not fit within my pyramid. Okay? So, another is drink fat-free milk, eat eat clean, crisp, raw vegetables as a snack, right? Another is eat fruits and cutters made with fat-free as desserts, and boil, bake, or boil instead of frying. Kasi the oil will addition of oil will add to the calories. Okay? So causing excessive weight gain during pregnancy. Okay? Okay. What about pregnancy-induced hypertension? Okay, so PIH, or pregnancy-induced hypertension. This is formerly called as preeclampsia or toxemia. Okay? This is characterized by hypertension. Kung the pregnant woman is experiencing hypertension or high blood pressure, sa ihi niya there's presence of protein, no, which normally dapat wala, no? Protein in the urine, and edema or pagmanas kanang sa tiil gani nga lo naburot naman iyang tiil, no. So it could be that could be an indication ng PIH or preeclampsia, no? High blood pressure, proteinuria or presence of protein in the urine, and edema during the third trimester. And this may progress into the eclamptic stage with convulsions, coma, and possible death of the mother and infant. Okay? Now, PIH or pregnancy-induced hypertension, higher incidence during first pregnancy, multi-fetal pregnancies, morbidly obese mothers, and those with inadequate diets, especially protein deficient. Okay. All right. So, pica. Have you heard about this? The word pica? Wala pa? Okay. Kana ganing if some of you are are consuming kana gani ganahan og kana magkit-kit og ice, that's actually a form of paika. For children, kanang magkaon og eraser, magsigigit-kit og eraser, that's actually a form of paika. Okay? So this is paika is the craving for non-food substances such as starch, clay or soil or ice. Okay? Um, my mother before, when she was pregnant with my youngest brother, no, our youngest, youngest sibling in the family, uh, sa maternity dress niya, sa bulsa niya, meron siyang actually raw na bigas, no? Raw na rice. And then, mo na ihang ginakaon from time to time, no? So, that's actually a form of paika, no? Okay. So, uh, okay lang kung makaon ang iyahang gina-crave. Ang problema dyan is ito, ingestion of soil should be discouraged kasi ang iba mukaon gyud og yuta class or clay, no? Ingestion of soil should be discouraged due to possible contamination and nutrient deficiencies. Multiple nutritional deficiencies can result from PICA. Okay? All right, anemia during pregnancy. Anemia is a condition caused by insufficiency of the RBCs or red blood cells, hemoglobin or blood volume. This causes weakness, fatigue, poor appetite, and pallor. Pallor is magiging pale, no? Or loose pad in Bisaya or Cebuano. Sorry. Okay, anemia naman. Okay, for anemia, again, no, still for anemia, iron deficiency anemia is the most common form of anemia during pregnancy. Folate deficiency may lead to megaloblastic anemia and is prevented by folate supplement. Okay. All right. So for alcohol, caffeine, drugs, and tobacco, okay. So I do not know if you've heard about fetal alcohol syndrome. Okay. Fetal alcohol syndrome is characterized by what happens, no? What can happen to the the baby when the mother is heavily drinking alcohol or is drinking alcohol during pregnancy. So there is what we call fetal alcohol syndrome. This is or FAST, no? This is characterized by a growth deficiency, central nervous system dysfunction, microcephaly or small head, and other physical characteristics. Yung iba naman, lang problema. Pero there is what we call fetal alcohol effect, no? Which causes fewer physical defects, but there are many behavioral and psychosocial complications of drinking alcohol during pregnancy. So anong itsura ng later I'll show you no parang ang itsura ng tao na merong may fetal alcohol syndrome is parang unggoy, no? I'm going to show you uh, I'm going to send you I'm going to send to you a photo of a child with fetal alcohol syndrome later, no, in our group or in probably in the Google Classroom. Okay, so alcohol, caffeine, drugs, and tobacco, abstinence of alcohol. So please, now, for pregnant women, never drink alcohol. Okay, caffeine, ng caffeine, students na mag-program kayo tapos pregnant, no, ladies, no? In the future, tapos you have to finish a project, no, a project or a task na you drink you drink heavy heavy na you drink coffee heavily, no, pila ka cups, no. So para to perk you up, no, to keep you awake, no. So remember that during pregnancy, no, kung magbuntis ka mo, caffeine has been shown to cause birth defects in rats, no. But no data exists in humans. But limit caffeine intake to less than 300 milligrams per day. Okay, pwede, pero not too much, no? Not too much. Okay? So, illegal drugs, ito talaga bawal, no? Illegal drugs can cause the infant to be born addicted. Okay? So, hindi pa napanganak ang baby, addict na. Okay? Yan. Ito na. No need pala to send to you a photo of somebody with fast, no, or fetal alcohol syndrome kasi ganito itsura ng ano, class. Nakita ninyo? So that child has fetal alcohol syndrome. Okay? So, ano mga features niya? Small head size. Ang forehead, narrow, receding forehead. Ang nose is short, upturned nose, flattened nose bridge. Ang jaw is underdeveloped. There's receding chin or receding or flattened upper jaw. Merong mga extra skin folds and eyelids, no? Yan ang ears, uneven, no? And lips, absence of groove in upper lip, flat upper lip, and then thin upper lip, no? This child was born to a woman, no? This child, as you can see, um, was born to a woman who drank heavily during pregnancy. So in addition to the unusual facial characteristics, children with fetal alcohol syndrome experience growth and mental retardation. Okay. Okay, so drugs derived from vitamin A can cause fetal malformations and spontaneous abortions. Okay. Another is for those na who are smoking, no? Not only for pregnant women ha, but also for those for any family member, no? Any family member na close to the pregnant women, this can actually cause sudden infant death syndrome, no? Matingala lang ka within the first year of life is mamatay ang bata, no? Um, this tobacco smoking, no, or cigarette smoking is associated with low birth weights, sudden infant death syndrome, okay, or SIDS or SIDS, uh, um, or we call that crib death, no? Crib yung kuna, crib death, fetal death, spontaneous abortions, ma-abort ang baby, and complications at birth, no? Kasi even if the mother is not smoking, then are also smoking, uh, nagiging second hand smoker yung pregnant women, no, pregnant woman. So that can cause sudden infant death syndrome or SIDS or SIDS. Okay. So diet for pregnant woman with diabetes. Okay, so ito medyo complicated, no? So the nutrient requirements of the pregnant woman with diabetes are the same as for non-diabetic pregnant woman. The dietitian should plan the diet depending on the type and number of insulin injections required. There's another term, no? Gestational diabetes. Normally, diabetes is a lifetime disease, no? Pero ang gestational diabetes class only occurs, no, uh, because of pregnancy. Now, gestational diabetes occurs during pregnancy but disappears after the infant is born. Taas ang blood sugar, no? And I will show you more bakit importante ang nutrition, no, for a diabetic woman, especially yung those who are um, those who are suffering from gestational diabetes. Okay? Mamaya, no, I will show you. Okay? So, routine screening for gestational diabetes is part of prenatal care. Insulin is used during pregnancy to control any type of diabetes. Oral hypoglycemic agents have not been used during pregnancy, and artificial sweeteners have been found to be safe during pregnancy. Okay, so ito yung what happens in gestational diabetes, no? High blood glucose level in the mother. Okay, so ang high blood glucose in the mother brings exertion of glucose to the baby. So magkakaroon ng the risk causes tingala ka dako kayo ang call
Sir,
that in
wala-wala
medical
na ka,
term
sir.
natin dyan class is macrosomia. Macrosomia. And
Sir, wala-wala na ka, sir.
sorry. Macrosomia, no? Actually, can you hear me? Hello? Clear na ba?
Putol-putol lang, sir.
Macrosomia. Okay. Macrosomia. Macro or
Sir, gamay na lang kayang madunggan silang istorya, sir.
yung overweight na pag pinanganak sila, malaki la, no? Kasi normally, ang average siya, no? 0.12 kay pa yan, na okay.
Sir, putol-putol ka, sir. Or sa ako alang.
Wala na din may madunggan, sir.
At tayo nagluod si sir.
Istoryahi dyan, istoryahi. Si sir.
Hello? Class, hello? Hello?
Sir, naano
All
sir.
right, okay. Sorry ha, I got disconnected so nag-data ko. Okay? So yun nga, bacrosomia, yung very heavy no or overweight ang paglabas ng baby no during af, at birth. Okay? So mga 9 pounds no? 9 pounds or more no? 9 pounds or more. Isang reason dyan is because of excess glucose no, during pregnancy. Okay? All right. You see, can you see the screen? Can you see the screen?
Yes, sir.
All right. Okay. So, yan no. How about pregnancy during adolescence? Uh, the nutritional, physical, physiological, social, and economic demands on pregnant adolescents are tremendous. Okay, so nutrition must meet the needs of her growing body and the needs of the fetus. No, so remember that adolescents they're still growing, no, and tapos meron pang growing fetus inside, no, and then they are also growing at the same time, no, kasi adolescents pa sila. That doble ang needs, no, ang nutritional needs niya, no. So high risk, this is high risk, yung mga adolescents na ano, yung early pregnancy, what I mean by early pregnancy is ano pa, teenage, example is teenage pregnancy, no? High risk, actually, they are high risk for pregnancy induced hypertension and premature delivery. Okay? So, yan. PIH, yung may hypertension, um, pregnancy, hypertension, proteinuria or presence of protein in the urine, and yung toxemia, yung PAH, protein in the protein toxemia, protein in the urine, at saka ano nga yung isa? Wait. Uh, yung edema, no? Edema or pagmanas, no? Pagmanas during the third trimester. Okay? So adolescents na mga ano, buntis, they're actually at risk of PIH, no? Or pregnancy induced hypertension. Okay? So, therefore, um, inadequate nutrition of the mother is related to both mental and physical birth defects. So much counseling and emotional support is needed. Okay, gone are the days na palayason ang ano no, ang ang mga teenage, because of teenage pregnancy, palayason, no? Gone are the days, no? So what they need is support, no? Okay, although we are not tolerating that, no, but what we what they need is really to support. So notes, we have macronia, epigenetics, fetal program, teratogenic. When you say teratogenic, this is a factor that causes abnormal fetal development and birth defects, no? SIDS, listeriosis, no? Dapat din mga pregnant woman, no? Dapat safe din yung pagkain nila, di sila magkaunog ka ng panis, no? Or this can cause ano naman, pagka-abort, no, abortion because of Okay? Postpartum amenorrhea is one, no? Postpartum amenorrhea, syempre, walang menstruation yan was, walang yan. And that's postpartum amenorrhea, or amenorrhea is absence of menstruation. Okay? Okay, now we proceed now to lactation. Lactation is a production and secretion of breast milk for the purpose of nourishing an infant, okay? Or this is breastfeeding, okay? Lactation or lactating, no? Um, recommended, this is recommended that no supplemental feedings be given until feeding routine is established. Human milk is formulated to meet the nutrient needs of infants for the first 6 months of life. No, so students, no, we need to promote feeding talaga as much as possible. No? Kung there are also instances na pwede ang breastfeeding because a mother has probably HIV or AIDS, no, merong probably terminal cancer, no, those are the conditions na hindi talaga dapat magpa-breastfeed, no. But under circumstances, other circumstances like nagka-fever ang nanay, actually pwede pa rin breastfeed. Okay? So, yun nga, in nutrition nga sabi namin um, ang gatas ng aso ay para sa aso or para sa pup, ah, yung puppy, no? Ah, ang gatas ng baka para sa anak mo. Oh. So, kasi actually yung mga ano, tawag nito, mga commercial formulas actually, formulas are actually from cow's milk, no? From cow's milk, pero that's minomodify to suit the needs of the infant. Di din pwede na cow's milk ang ibigay mo kasi iba yung content uh, ng cow's milk to um, the to breast milk, no? So makadaot na siya sa kidneys, yan. All right, so benefits of breastfeeding for the infant. Breast milk has the perfect composition for the baby's needs, and no babies are allergic to their mother's milk. Human milk contains at least 100 ingredients not found in formula. Okay, another is lower incidence of ear infections, diarrhea, allergies, and hospital admissions. Breastfed babies receive antibodies from breast milk, and it also promotes good jaw development and decreases risk of obesity later in life. And this facilitates bonding, no, of the mother and the baby. Okay. It also helps lose the weight gain during pregnancy, no? Kasi if you are lactating, no, or breastfeeding, you are producing milk, so it requires nutrients, or especially energy, no, and protein, no. So it will help lose the weight gain during pregnancy. It stimulates the uterus to contract back to its original size. And breastfeeding is also economical. It provides opportunity for resting, no? Kasi you don't need to, pag commercial formulas kasi, yung um, bottles na ginagamit is kailangan mo pa siya initin, no? Um, initin para before you add the milk or before gamitin, no? So maka-rest ka. Okay, so basta ano lang, you just have to clean the breast and voila, anytime, no? And then perfect din ang temperature ng breast milk, no? So milk is always at the right temperature and is readily available. Okay? So, kung for example, um, kung during pregnancy is plus 300 kcal, ang idadagdag mo sa normal region, pag pag uso yan, um, that's actually additional of 500 calories per day. Okay? So, ang example natin earlier was 1,600 pre-pregnant, no? So, for example, 1,600, hindi yan buntis, no? Normal, no, na babae. Considering the height and the physical activity. So, pag magiging pregnant yan, plus 300. So, magiging 1,000 ang energy, 1,000, 1,900. Okay? 7, 8, 9. 1,900, correct? Okay, so pag lactating or pag magpasuso yan class or breastfeeding, plus 500 calories a day. So, yung 1,600 plus 500 pa yan because of the production of milk. Okay? So, plus 500 calories a day yan siya. So, 1,600 plus 500, that's 2,100 calories per day. So, most nutrient requirements are increased, especially protein. And nutrition should be based on the food grade pyramid. And fluid intake should replace fluid used for milk production. So, dapat hydration talaga, no? Kasi the milk contains milk, no, breast milk contains or human milk contains also water, no. Therefore, hydration is very important. Okay, so most chemicals can pass into the mother's milk, no. Kaya the mother who is breastfeeding should not be taking too much coffee, no? Kasi yung caffeine can pass through the breast milk, no? So kung makapass yan into the breast milk, ang breast milk may contain caffeine, so dili makatulog ang baby. And you know, babies need to sleep, no, often, or drinking alcohol, matingalang ka, hubog na ang baby kasi the alcohol can pass through the breast milk. Okay? So, pwede din mahubog ang katong baby, no? So, ganyan siya, no? So, most chemicals can pass into the mother's milk. So, check with obstetrician before using any medication or nutrient supplement, and caffeine may make an infant irritable. Okay, so what are the considerations for the healthcare professional? Articles in newspapers and magazines may be inaccurate, re-education may be necessary, and teaching pregnant teenagers present the biggest challenge. Okay, so kayo, bata pa kayo. All right, so conclusion, a pregnant woman is most likely to remain healthy and bear a healthy infant if she follows a well-balanced diet. Anemia and pregnancy-induced hypertension or PIH are two conditions that can be caused by inadequate nutrition, caloric and most nutrient requirements increase for pregnant and lactating women. Okay, so all right. So before we proceed to our topic, next topic, what did you learn in the session? In the topic, pregnancy and lactation.
All about pregnancy diet, sir.
Yeah, diet about pregnancy and pregnant and lactating women. All right. So the importance of nutrition during pregnancy and lactation. No? So I do not know how are you going to use this in the development. Well, of course, normally pag magagamit nyo ito kasi later on, well, in the future, you become parents, no? Or members of the family, magagamit yung whatever uh, magagamit nyo in the family or to for men for your future partners, no, or wives, wife, no, for pregnant for ladies, magagamit nyo ito for the future, no. Magagamit nyo even your friends, no, or whoever you know, no, magagamit nyo ito. Pero ang akin lang is the challenge is paano kaya in the profession, no, na sa pagiging IT ninyo students, ang challenge there is how to use these concepts, no, or everything that you've learned in in information technology. I do not know how are you going to do it, but definitely is a way na magagamit nyo ito. Okay? Alright. So, okay. I think let's just have two uh two s- topics. I guess two topics for today. I think will be okay, no? I mean two topics for today. That includes pregnancy and lactation and yan. Okay, just we're just waiting for the PowerPoint. Okay. See the screen? All right. So our next topic is diet during infancy, no? Medyo double time kasi ano na finals na, no? So diet during infancy. Okay. So those are babies, no? So objectives for this topic is state the effect that inadequate nutrition has on an infant. Discuss positive aspect of breastfeeding and bottle feeding. Describe when and how foods are introduced into the baby's diet, and describe inborn errors of metabolism and their dietary treatment. Okay, so nutritional requirements of an infant: birth weight doubles by 6 months of age, no? So ang birth weight is usually normally kunyari at birth, no, pag panganak is kunyari 3 kilos. Expected yan pag 5 to 6 months mag-double ang weight. Okay? So for example, 3 kilos, expected yan pag 5 to 6 months, magiging ano yan, magiging 6 kilos yan siya. Okay? So imagine kung tayo, for example, after 5 to 6 months, magdo-double ang weight natin. Gaano na mga giants sa siguro tayo, no? So, ang mga babies, ganyan ka-fast ang growth nila. Okay? So, and triples within the first year. So, triples the birth weight, no? So, expect ko, kunyari, 3 kilos at magiging 9 kilos yung expected na weight ng baby at first year of life or at 12 months is 9 kilos pag 3 kilos, no? Okay, during the first year, the normal child needs about 98 to 108 calories per kilogram of body weight each day. So sa atin normally depende 25, 35 calories per kilogram, no? But for them it's 98 to 48 108 calories, kaya sila sige sila dede, they ask for milk, no? And also they rest, no? Sige sila tulog, no? Ano lang, kauntulog lang na ang ano sa mga bata, no? Because they need more calories, no? Than an than adults, no? Or even children, no? Infants need 1.5 ml of water per calorie, and nutritional needs depend on child's growth rate. Okay, so vitamin K is only given at birth, and basis on infant's diet, and excess vitamin A or D can be toxic to infants, and vitamin D is less needed. Okay. So breastfeeding provides infant with temporary immunity to many infectious diseases. It is economical. Don't need to spend mahal ka as karon no. Um, okay, malinis. Breast milk is easily digested. Breastfed infants have fewer infections than formulas, no? In the first few weeks, no? So probably you can have an app probably kung for lactating women na okay, which will tell na okay, how long ang ma-track ang kung kailan ang kailan ka nagpa-breastfeed, no? Just like what I do, no? Um, I'm I'm starting to I'm starting biking right now, and I'm using this app na ay na to. May mga nagbike ba sa inyo? May nagbike ba sa inyo ngayon or hiking?
Yes, sir.
Oo, so I'm sure you're using an app. What app do you use?
Wala man, sir.
An app? Okay. Kung pila ka pila ka um pila na ka kilometers ang inyong na
Wala, sir.
pila ka
Kanang,
kilometer
ano lang, sir, kung kanus alang, kung unsa kayo na makaya.
Okay. Kasi I'm using an app. Actually, it was your yung Relieve. Ito, nakita ninyo? Relieve. Nakita ninyo?
Yes, sir.
Oo. So, ito yung ko, kahapon, nag-bike ako for 4 kilometers, no? To track on my kung ilang hours at saka saan ako no? Like, let's say for example, ito. Let me share to you. Yan, no? Makita ninyo? Oh, sa bahay yan, up to yan. O, nag-bike ako niyan. Nakita ninyo? Oo. So, probably you can also make use of an app na ayan, I'm using that app, no? Tapos, meron ding kung for example, ilang calories ang nabawas, no? may mga app din na ganyan, no? So I use itong Relieve. Okay? Uh, I use that, no? This yung app na ito. So pwede na uh, pregnant and lactating. Probably you can have an app, no? I do not know if there's already an existing app na uh, there's already an existing app na matrack yung kailan ka nagpa-breastfeed or that will remind the pregnant woman kung dapat na ba siya mag-breastfeed or not. I do not know if it's possible, no? Okay. That's an app, no? You can that I use, no, for my biking, no? Okay. So possible, no? Okay. Uh, right. So wait, sana ba 'yon? Okay. Can you see the screen? Can you see the screen? Oh, start podcast. Hello? Hello?
Makita na.
Yes, sir.
Okay, wait. All right. Can you see the power?
Opo.
Okay. So for this, okay. Breast milk is easily digested. Breastfed infants have fewer infections. Breastfeeding promotes oral motor development, no? And breast should one should nurse 10 to 15 minutes on each breast, no? So I do not know ano nyo ito, no? Growth spurts occur at about 2 more frequently. All right. So breastfeeding is also beneficial to mothers. Actually, there's less risk of breast cancer and osteoporosis to the mother. Okay. So breastfeeding indications of adequate nutrition include how do you know if baby is properly nourished or is well nourished? Okay, the infant is 6 with that day. The infant has normal growth, no? Um, we will we will use the nutrition assessment, no, to do this. And the infant has 1 to 2 bowel movements per day, no? Magbawas siya for 1 to 2 bowel movement per day. The baby becomes less full during nursing or infant should be cuddled and held in a semi-upright position. Baby should be burped often. Okay, so burping the baby after. No, so this is for bottle feeding naman. No? So we cannot judge also those who we are promoting breastfeeding, pero we cannot judge those who prefer. Pero as much as possible, we advocate breastfeeding, no? So formulas are made from creams mainly used for allergic infants. Okay? So amount of and complications. Use consistent temperature for formula. Okay, so dapat consistent ang temperature, no? The moment you introduce